This paper here was very interesting because we had a group of asthmatic children who were also mouth breathing. And we not only investigated asthma, but also what was investigated was their sleep. We have to bear in mind that asthma is a condition. It's not just about asthma. It's not just about asthma for children, and it's not just about asthma for adults. When one has asthma, there is inflammation in the lower airways. But more recently, it has been recognized that the lower airways and the upper airways are linked. It's a unified airway. So since 2014, researchers have recognized that if there's inflammation in the lower airways, it can travel up to the upper airways, which is the nose, the nasal cavity. And if there's inflammation in the nose and the nasal cavity, it can travel down to the lower airways. So an individual then with asthma has an increased tendency to have nasal stuffiness. And with increased nasal stuffiness, the likelihood is that we breathe through an open mouth. With mouth breathing, we also have increased agitation and we also have poor sleep. So when we have a child presenting with asthma or an adult presenting with asthma, we need to consider their breathing patterns. Mouth breathing and fast breathing and upper chest breathing is going to adversely impact sleep. These individuals are at much higher risk of sleep disorder breathing. They're waking up tired, they're more likely to snore, to have obstructive sleep apnea, to have hypopneas. The child then in school, they're going in tired, they cannot concentrate. If you cannot concentrate, it is normal that you can feel frustrated. And if you're feeling frustrated, that you can exhibit behavioural difficulties. When we are looking at asthma, we need to consider the wider range of effects here. The increased anxiety in this group of individuals, the increased sleep problems in this group of individuals, and of course the asthma problems. It is a condition that feeds in itself. Mouth breathing that's feeding back into constriction of the airways with increased inflammation contributing to nasal stuffiness, increased nasal stuffiness which reinforces mouth breathing. Mouth breathing which then in turn increases the risk of sleep problems by 1.8 times. And with increased risk of sleep, that in turn is feeding back into anxiety. The mouth breathing also feeding into anxiety because we're not using our diaphragm as effectively. We're more likely to be fast breathing using the upper chest. Diaphragmatic breathing is really important for maintaining stability of the mind. If we're using upper chest, we are in that fight or flight response. And when we are in that fight or flight response, we breathe faster. Faster breathing in turn will feed back into asthma. Any healthcare professional who is working with asthma, please consider the impact that breathing pattern disorders is having on your patient's asthma. Don't just rely on medication. And of course, there is a wonderful role of medication in the treatment of asthma. But there is also a wonderful role of simple strategies that you can give to your patients. Breathing through the nose, slow breathing using the diaphragm. We can help reduce asthma symptoms, especially in those asthmatics who have poor asthma control. I was one of them. For 20 years, I was visiting doctors' departments. I presented at emergency departments. I was a constant mouth breather. I had constant nasal stuffiness. My sleep was affected. My concentration was affected. And it wreaked havoc on my life. I heard about the importance of nasal breathing in 1998 by reading a newspaper article. I did the nose blocking technique, I switched to nose breathing, and it made a tremendous difference to my quality of life. We have 500,000 individuals in Ireland with asthma, 5.6 million in the United Kingdom, 20 million in the United States. How many of these are taught the importance of functional breathing using the nose, slow breathing? How many are given the tools to effectively help their own asthma? It's not just about medication. We also need to look at breathing. It's not just about asthma. We also need to improve their sleep and their anxiety. And we can do that by simple strategies to change breathing patterns.